So what does the COVID-19 alert designation for Lucas County mean? Now that we are in the orange, many people think that it's okay to go back in public, to go back into in-person learning. What are your thoughts on this new designation by the state?
A couple things. I just want to caution everybody that we went from red to orange, which is really good for us. But again, that's because of things that we've been doing. Again, wearing face coverings. Again, practicing good hygiene. Again, limiting going to mass gatherings. If we decide that, okay, since we're now orange, we can go back and do things like we did, months and months ago, we can't do that. Again, we're only going to stay in orange is if each of us take it upon ourselves to continue to do those things. Relative to going from red to orange, we were at one point in time, 150 per 100,000 of cases, and then we went down to 115, down to 102, we went up. We came down the other week to 93 and then to 84. So again, at this point in time, we're closer to 100 than we are to 50. And remember, we want to be well under 50 to say that we're doing a good job in our community with fighting COVID.
What do you think contributed to this drop in cases countywide?
I think there's a couple things. One, people are taking face coverings, again, much more of an importance in our community. I do believe that we're not mass gathering as much as we might have been, a month or two ago. I think there are people that are really starting to say, if we want to go back to school, if we want to go to sporting events, if we want to keep COVID low, we got to do some things, and they're doing that. I think too, it's just kind of the oscillation of the disease. We see that some of the larger counties that were once in the top 10 came out of top 10 and now they're back in. So again, just because we're out of red and in orange doesn't mean that we're going to stay there.
Do you recommend students return to in-person instruction because we're now at the orange category?
I think there's a couple things that we need to realize is just because we're at orange doesn't mean that there aren't other criteria we should be looking at. Some other criteria are, our infection, our positivity rate inside of the community. So in other words, we're at 5-6%, and really, to safely do things in our community, we want to be under 3%, closer to 1. 0 would be great, but again, that's not going to happen anytime soon. So again, that's a criteria. Testing has been another concern, which we're doing better with. In other words, able to get out and get tested, but then that test comes back quickly to us so that we can do contact tracing. So that's improving. But again, just one criteria, can't really dictate whether, it's okay to go out and go back and do things. At this point in time, the Board of Health still has the recommendation of October 1st. That has not been changed.
How can people get tested for COVID-19?
So again, if you go on our website, there's a listing of places where you can go get tested. At this point in time, it's not like it was a couple weeks ago where people were waiting days and days. It's actually pretty quick turnaround time. Anecdotally, I've heard, again, even just a couple hours to a day to get your appointment and to then get tested. And that turnaround time has been about 48 hours, maybe a little bit more on the average. So again, we're getting the turnaround time that we want to see.
Before anyone goes out in public, what should they know to protect themselves and to protect others?
Again, that face covering is so important. And again, you want to see people wear face covering that you're interacting with, and you want to wear that face covering because, again, it does prevent droplets, if you would, from going from me to you and you to me. It may not be 100% effective, but again, as long as we can stop those droplets, or as many as we possibly can, the less likelihood of an infection or an exposure. So that's really important. Again, the big thing too is we shouldn't be mass gathering. We've heard those stories of some facilities where people have gathered where they've actually packed the restaurant, and that's not something that I want to be in, because again, the possibility of exposure. But then we also understand that mass gathering like that increases the possibility of an exposure.
How long do you expect a vaccine will take to make it to our neck of the woods here in Lucas County?
Again, we're hearing things, if you would, chatter from the research community, again, from government. There is a possibility of maybe having something before the end of the year. I would not expect that per se to be anything large scale. Again, I'm taking a kind of a little bit of an educated guess here, but definitely before the first quarter of next year ends, we should be seeing probably a substantial amount of vaccine. But again, it's going to be years before we can vaccinate everybody like we'd want to stop COVID in its tracks, if at all possible.
Lucas County Health Commissioner Eric Zgodzinski, thanks for joining.
Thank you so much.